Hello, my name is Fatin Akila binti Johannes. My metric number CE160173. Okay, I want to present about the abstract. Conjoined twins are rare and present the pediatric surgeons and radiologists with a unique challenge. Conjoined twins are classified according to the most prominent connection site such as thoracovagus, cephalophagus, pharophagus. So, recent advancement in computing power and previous additive manufacturing has already made 3D printing become possible to design, optimize and reproduce patient-specific procedures and prosthetics applications. Brain magnetic resonance image has become a hotspot in the fields of segmentation of medical image, since segmentation is directly affects subsequent pathology research and clinical education. Okay, for the part introduction, neuroimaging technologies such as MRI and CT scan have become invaluable methods for central nervous system disease diagnosis and treatment. Okay, we focus on segmenting for 3D printing applications, especially for patients, because this area remains less developed. This imaging technique provides a wealth of knowledge on human tissue and organs, anatomical structure and functional status. Okay, that's all from me. Thank you.
Hi, Assalamualaikum. My name is Nur Alia binti Ahmad Taufik. From ultrasound to MRI to CT scan, radiologists need and use medical imaging to properly diagnose and treat diseases. Doctors also use medical imaging technologies to determine whether a particular therapy has been effective in patients. According to a web-based journal which is Advancement in Medical Imaging Technology, there have been many developments in medical imaging technology due to the important research and technological evolution. This progress is important in making diagnosis more reliable and in improving patient care. There are 4 major advances: open and portable MRI, big data and analytics, 3D capabilities, and digital mammography. Open and portable MRI. Traditional MRI, particularly for those with claustrophobia, has caused great anxiety in patients. The whirling noises coupled with the feeling of being trapped is not one that anyone willingly would endure. But today, MRI machines are open. They are less restrictive and more flexible on the sides. Big data and analytics. Analytics is often used to detect patterns specific to a certain pathology. Imaging algorithms can derive metrics using intensive analysis of the patterns in a digital image, and then deliver scores that complement any analysis made by the radiologist, resulting in quicker, customized, and more accurate diagnosis. The future of analytics in diagnostic imaging data is promising. According to the web-based journal Top Trends in Medical Imaging Technology, we can look forward to a new and interesting features in the radiology information system and PACS system, especially those in the cloud, which might include analytics and impressive report on operational and clinical data. 3D capabilities. Using 3D technology, ultrasound accuracy can be improved and patient treatment can be enhanced. Experts have also been exploring 3D capabilities in imaging, specifically in CT scans, and have stated that the increases the contrast of soft tissues can reduce the visibility of metal artifacts compared to traditional CT image. Digital mammography. Digital mammography provides a much greater level of detail compared to traditional techniques and can be produced the same result as conventional mammograms without the use of film and X-rays. According to a journal which is Top 5 Advances that are redefining medical imaging technology by Jennifer Livingston, digital mammograms are more efficient than traditional mammograms. The future of medical imaging can be transformed with the relevant regulations in place, enabling those solutions to be freely available for all to benefit from.
Hello, my name is Wano Ashikin. I will explain for the content A, which is about conjoined twins and role of medical imaging. So what is conjoined twins? Basically, conjoined twins are two babies that are born physically connected or fused to each other. How it is developed? The development occurs when an early embryo only partially separate to form two individuals. Even two features will develop from this embryo, they will remain physically connected. The location and the extent of fusion of conjoined twins can be vary. There are various types of conjoined twins. The differences are determined by how the twins were physically connected. As in the table, mainly there are 8 types of conjoined twins. There are few important roles of medical imaging in this conjoined twin issue. The first is prenatal assessment. Antenatal diagnosis of conjoined twin can be made with ultrasonography as early as 12 weeks. More accurate evaluation of visceral conjunction is possible from 20 weeks and should include fetal ECG. Accurate antenatal assessment allows the parents to be counseled in depth as to the likely outcome of the pregnancy and the chances of postnatal separation and survival. The second is surgical consideration. The surgical procedure performed depends on the site and complexity of the conjunction and the type of organ shares. Accurate determination of anatomy and vascular supply is important in planning the separation of the twins. All conjoined babies will undergo echocardiography because there are higher frequency of cardiac abnormality case in all forms of conjoined twins. They also will be assessed by combination of ultrasound, ECG and plain radiography. It is easily performed in ICU and not required sedation and anesthesia. For stable condition baby, they will go for full range investigation that include MR imaging and CT scan. There are few more important roles of medical imaging in this conjoined twin issue. Definitely, imaging of various types of conjoined twins are completely different. Besides that, 3D printing and 3D modeling also plays a major role. Overall, the advantage of medical imaging and 3D image include pre-surgical planning, reduce time in operating room, reduce the rate of morbidity, and obviously for a better outcome. Thank you.
I'm Hazima binti Nur Azmi. I will present about application of 3D printing in medical imaging. It can be quite challenging, especially when deciding on the best approach to surgery. This joint separation was easier to do with the development of the medical technology, but it was still a dangerous procedure to deal with. The case of the female twin from Kenya, they were born on a random method. In the beginning, there was no visual or information concerning the conjoined twin. The printing process used in the surgery, it helped to recognize and visualizing the case of the joint twin. Besides that, dummy was basically used by the doctor in the determining the best form of the surgery without damaging the actual subject. MRI was more efficient compared to other methods due to brain was involved in the conjoined part. It is also able to minimize the risk. In this case, MRI provide also visual information that show vein, blood flow vessel also critical in the body tissue. As this help is figuring out the blood flow and critical vessel. In other way, CT scan also used for post-operation which lead to the result, and visual information help the twin to survive the operation also after operation state.
Assalamualaikum and hi. My name is Shira Shahira binti Mahmud Arsaid. My street number is CE 1C0068. Now I'm going to explain one of the specific method or technology used in order to help the surgeons to plan and practice the separation of conjoined twins, which is 3D printing. So, what is 3D printing? Okay, by referring to the journal written by Amedy, Shiloh, Noy, Blank, and Richard Meow, three-dimensional printing is based on additive technology, in which layers of materials are gradually placed to create 3D objects. The ability to produce a printed model from digital imaging and communication of medicine data derived within CT scan, MRI, and ultrasound scanning has been coupled with new, less expensive 3D printed technology. Okay. Depending on the area of interest, a printed model demonstrates anatomical and structural fidelity consistent with the patient's actual disease process. This fidelity has allowed surgical teams to plan interventions more accurately and guide margins of resection, model appropriate implant dimensions, and sometimes create the implant itself using the 3D printing technology. There are essentially 5 important related steps to the 3D printing process to create a printed model. 5 technical steps that required to finalize a printed model is represented in the article written by Palermo, Aymar, and Innocenti. Okay. So, the first step of the process is image acquisition, which is target area selection. Second step is segmentation, which is DCOM to STL conversion. The third step is file optimization, which is for the final print. The fourth step is 3D printer and material selection. And the final step of the process is print. Okay. Validation and quality control. In this way, the 3D printing could be an attractive, versatile, and powerful technology which has the potential to significantly increase the level of understanding of the disease involved. Creating a 3D geometrical model requires a high level anatomical knowledge and coordination between a surgeon, radiologist, and engineer. Okay, it is a respectively simple concept, but does require specific multidisciplinary expertise. Technical expertise and cost are the important considerations when starting a 3D printing program. Based on one of the channel related to the case involving the successful separation of conjoined twins, Safa and Marwa, written by Julie Ong, he stated that the surgeons used a wide range of 3D technology in order to examine the problem surrounding the unusual anatomy of the two girls. Their knowledge and experience of similar cases was very limited, as the model that they want to develop was found in just 1 in 2 million birds for a very rare disease. Therefore, multiple models has been developed before the surgery, which then enabled them to cut the models physically in order to test several potential approach and procedure. The models were designed to familiarize surgical teams with the size of the skull, where the suture line were located, and the location of the relevant anatomy on the bone surface and of the brain, dura, and vasculature.
Assalamualaikum. My name is Farah binti Aman, and currently I work at Regency Specialist Hospital Masai, Pasir Gudang. First of all, thanks for choosing me in your project. For the first question, actually I don't have any experience on conjoined twin case at my current and previous hospital, but from my view, our medical technology are now to ahead since Mr. Charles Hull applied 3D printing in medical field. 3D printing was the first used for medical purpose as dental implant and custom prosthetic in the 1990. Often medical imaging techniques such as X-ray, CT scan, MRI, and ultrasound are used to produce the original digital model, which is subsequently fed into the 3D printer. 3D printing in the medical field is creating patient-specific organ replica that surgeon can be used to practice on before performing complicated operation. This technique has been proven to speed up the procedure and minimize trauma for patient. One example case shows in 3D printing technology very helpful in conjoined twin are approved on October 2019, where a surgical team stood up two 13-month-old boys who were joined at the head and share up to 2 inches of brain tissue. The surgeon didn't go through medical training or have a guidebook to learn how to separate conjoined twin. So what they are able to do is create 3D visualization and physical printing of the brain model and use it as a guidebook. On surgery day, through the 27 hours operation, the surgical team repeatedly referenced the model, and when it was complete, the boys were lying on different bed for the first time. Actually, 3D system has collaborated on dozens of conjoined twin cases over the past decade.
Okay, now for the question 1. From her experience, she doesn't have any experience. From her view, is many hospitals now apply 3D printing in the medical field. 3D printing was first used for medical purpose as a dental implant and custom prosthetic in the 1990s. Okay, now many medical imaging such as CT scan, X-ray, MRI and ultrasound are using 3D printing. So 3D printing in the medical field is creating patient-specific organ replicas that surgeon can be used to practice on before performing complicated operation. This technique has been proven to speed up procedures and minimize trauma for patient. Yes.
Okay, for the second question, if we looking back at 50 years, which is around 1917, our technology now are more advanced. Before this, we only have 2D image ultrasound. But now our technology much better, which we have 4D image ultrasound. This 4D ultrasound can show certain birth defects such as cleft palate that might not show up on standard ultrasound. Other than that, PET-CT are proven to be more effective at diagnosing cancer than standard CT scan. So not possible if in 3D system also we can be improved to 4D system, which it can bring more facility to surgeon in planning their surgery and indirectly reduce complication.
Okay, now summary for question 2. She just said, if we looking back at 50 years back, our technology now are more advanced. Before this, we only have 2D image ultrasound. Now, what we got is 3D system is also improving to 4D system, which can bring more facility to surgeon in planning their surgery and indirectly reduce complication. Okay.
Okay. The chance that conjoined twins will survive are minimally, but the chance that both conjoined twins will survive surgical separation are even thinner. About 75% of surgical separation resulting in at least one twin surviving. Approximately 200 pairs of conjoined twins are born alive each year, and about half die before their first birthday. Surgery to separate conjoined twin may range from very easy to very difficult depending on the point of attachment and the internal part that are shared. If they are joined at the head, maybe one twin has most blood vessel going into the head, while the other one has a lot of drainage. All the connection have to be divided separately, and over a period of time, the twin can develop a circulation for themselves. In other words, every operation have their risk.
Okay, now for the summary question 3. Okay, she just said the chances the conjoined twins will survive are minimal, but the chances the both conjoined twins will survive surgical separation are even tinier. 70% of surgical separation, resulting in at least one twin surviving. Approximately 200 pairs of conjoined twins are born alive each year, but about half die before the first birthday.
For me, beside conjoined twin, craniectomy is one of the complex case which is it involve brain. Any type of brain surgery present a high risk to the patient because the brain control every function in the body. But a craniectomy present even more risk. This procedure requires that the piece of skull removed to access the brain is not replaced after the surgery is complete, leaving fully recovered patient the risk of brain damage after the surgery if they do not properly protect the head. Depending on the area of the brain where this procedure will be performed, other serious risks like change or loss in the function of vision, mobility, speech, memory, coordination, and more can be permanent. Excessive build-up of fluid in the brain, stroke, seizures, spinal fluid leakage, swelling of the brain, and more can also occur after the procedure, making this one of the highest risk surgery. Other than that, coronary revascularization are also known as coronary artery bypass grafting (CABG). This procedure reroute the blood around one or more clogged coronary artery to help improve blood flow to the heart. New connections are made using artery or vein graft taken from another part of the patient's body. For some patients whose ventricular function is failing too quickly, this surgery may not be an option because the risks are too high.
Now for the summary question 4. For her explanation before this, beside the conjoined twins that are complex cases, craniectomy is one of the complex cases which is involve the brain. Any type of brain surgery present a high risk to the patient because of the brain control every function in the body.
As I explained before, the data collected from the medical imaging techniques such as CT scan, MRI, X-ray, or ultrasound was sent over to the 3D technology system and they create a 3D digital file of it. Just like a 3D movie, this virtual environment are able to show in-depth information about anatomy that is not available on a standard computer screen. From there, 3D printed anatomical model were developed which vividly display the twin anatomy in which they are connected, and the best part is the surgeon can hold and play with this model so they can plan their surgery beforehand. Once this model complete, it will take into the operating room for reference during surgery.
Okay, for the summary question 5. From her explanation before, the data collected from the medical imaging techniques such as CT scan, X-ray, ultrasound, and MRI was sent over to the 3D technology system and they create a 3D digital file at it. Once this model complete, it will take into operating room for reference during the surgery.
Actually, antenatal imaging by ultrasound play a vital role in the diagnosis of conjoined twin. If parents choose termination of pregnancy, it should be done at an early stage of pregnancy. Successful separation of conjoined twin required the effort of a specialist, including radiologist, obstetrician, and pediatric surgeon. Data from MRI, CT scan, and X-ray are really needed in creating anatomical model in 3D system. From the 3D anatomical model, it not only helps surgeon in pre-surgical planning, but may also help to reduce complication of the twin.
Okay, now for the summary question 6. Okay, actually, antenatal imaging by ultrasound play a vital role in the early diagnosis of conjoined twins. If parents choose termination of pregnancy, it should be done at an early stage of pregnancy. Successful separation of conjoined twins require the effort of the specialists, including the radiologist, obstetrician, and pediatric surgeon.
General anesthesia machine are one equipment that widely used in operation. It used to monitor the unconscious or deep sleep condition in patient. Other than that, electrosurgical unit also need to use because it used to control the bleeding of the patient. If it is involve a heart separation, heart lung bypass machine are really needed to take over the function of the heart. Other than that, surgical microscope, it assists surgeon to clearly see the vessel, nerve and other part inside our body.
Summary last question. Okay, general anesthesia machine to monitor the unconsciousness, deep sleep condition in the patient. Surgical microscope, it assists surgeon and to clearly see the vessel nerve. Electrosurgical unit to control bleeding if it involve the heart separation. Heart lung bypass machine are really neat.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Ridwami Ismail. My metric number is DE160058. Alright, I will explain about the summary of the conjoined twin and including the conclusion of this topic and title. Alright. So, as the conclusion that related to the topic of conjoined twin, the separation of conjoined twins present a challenge to the pediatric surgeons that need to interpreting the result of the pre-operative imaging, poses with an unique challenge to the radiologist. Medical imaging equipment that contributes to the success rate of conjoined twins, which is MRI, that provides excellent overall anatomic demonstration and visceral conjunction and organ position. CT scanners also provide good anatomic detail, which is separates intravenous contrast material injection in each twin to help each other establish whether there is separate or crossover blood supply to solid organ, so that we can figure it out. Certain imaging modalities and investigation are desirable in evaluating conjoined twins and can be determined according to the primary site of conjunction. However, each set of twins is unique, although generalization can be made. The exact imaging performed must be tailored to the twins involved and the requirement of the pediatric surgeons conducting their separation. Alright, that's for the conclusion of the conjoined twins. That's it from me. Thank you.